Good morning, dear viewers. You're most welcome to the Daktari show, a health educative show which airs here on West Nile TV every Thursday from 11 a.m. to noon, where we bring you personnels in the medical field who come to educate you, the viewers, and the entire population who view West Nile TV about matters regarding your health. And of recent, we had further exciting topics for you in package. Today yet, there is another we have for you, which will regard stroke. And before we go into what we have for you today, let our guest of today introduce himself before we pick on from that. Doctor, you're most welcome to the Daktari show. You can introduce yourself to the viewers.
Thank you very much. My name is Dr. Lwanga Tony, and I work with IMC Arua. We are located just behind the stadium on Arua Hill as of now, but starting next month, actually you'll be able to find us in the middle of the city, close to Centenary Bank. I'm very happy to be here. Thank you very much.
Thank you too very much, Doctor, and also we are grateful to the to the facility IMC for giving in the personnel to come and educate the viewers. We can't take that for granted. Okay, so let's speak on, Doctor. Our topic of today is regarding stroke. People often in the society, especially maybe let me say the young or the youth, they hear like their elderly or the parents have stroke, and some couldn't actually know what stroke is. Maybe to break it down to the viewers, what is stroke?
What is stroke? Stroke is actually a big thing that is disturbing the whole world at large. And if someone who is a layman or just a normal person, if you talk of stroke, they understand it as paralysis of the body part. Okay? So someone will tell you that my hand or my leg can no longer move. My mom has one side that can work, the other side does not work properly. So to a layman, that is stroke. But medically, we define stroke as a vesicular or a neurological deficit that comes in as a result of a vesicular compromise. So note these words: neurological deficit. That means it is something that concerns the neurons or the brain system. And it's coming in as a result of a vesicular compromise. So the cause of the problem to this brain system is actually something that is coming in from the blood vessels that are supplying the brain. So in a simple way, that is stroke. A problem that comes into the brain as a result of a compromise or a disturbance in the blood vessels that supply that brain. So that is stroke, and it is something big. Actually, as of now, if you are to look at the statistics globally, stroke is one of the diseases that cause death. After cancers and after what we call ischemic heart disease, that is a disease concerning the heart, stroke is the third. So that is the magnitude of how dangerous it is. When you come to the number of people annually or per year that are suffering from this disease, you look at statistics from WHO, they will tell you at least 15 million people get this disease every year. 5 of them die. That is how bad it is. 5 million people of those 15 die.
Accounting forms a third.
Exactly. And then the other 5 million people are left with disabilities. That means they can no longer do what they will do in a normal state whereby they are really happy. Then the other 5 is actually not accounted for. Now come to our Uganda, where even those people who are having stroke are not documented. That means it's actually a bigger number than we actually think. So briefly, Understand? That's what we call stroke.
Okay. Thank you very much, Doctor. Hope our viewers have gotten to know what stroke is. A neurological deficit which will affect the brain system. And indeed it's worrying. And you have given us the numbers where almost a third of the people die. And you have told us globally it's the third leading cause of death. Yeah. So hope our viewers, you are taking to know how dangerous stroke is, and keep on as he'll take us through on ways we can prevent getting this stroke. So maybe, Doctor, now to ask, you have told us it's a neurological deficit. Which system is mainly affected here? Okay.
So with the system, it is actually your brain that is affected here in stroke. If you look at a computer, for example, this one here, you'll find that it has what we call a motherboard. On that motherboard, it is where everything that you do on the computer, all the commands are coming in from there. So there is nothing new under the earth. That's what the Bible tells us. So when you look at a human being, we have the central point, which is the brain. Your brain controls each and everything on your body. So you find that there are different points on the brain that control, let me say, this hand. Another point of the brain that controls the leg. Another point of the brain that enables you to see. For you to hear, it's a particular point of the brain. So it is that nervous system or the brain system that is affected in this place. And like we said in the definition, it is issues are arising from the blood that is supplied to that area. So like on a computer, if you have that point that controls the way the mouse moves, if it is defected, you will see the result coming in that the mouse is no longer able to move on the screen. If you are typing and you are typing your name, my name is Tony, and you are typing T. So if the point on the motherboard for T is no longer functioning, or it has a problem, however much you press T on the keyboard, the computer is unable to receive. So the same thing happens with us. If that point on your nervous system is defected, or it's no longer receiving blood, or blood has now actually poured inside there, so it stops functioning, and you will see the result with your body part, that place is no longer able to move. So the system affected here is the nervous system, and specifically we are talking of the brain. Yeah.
Thank you very much, Doctor. Hope our viewers, you have gotten to know stroke mainly affects the brain, and Dr. Tony has told us it's as a result of maybe limited blood like flow to the particular part of the brain, or maybe when blood pours. Now that one triggers me. Could we be having like classificational types of stroke? Yeah.
Yes. Okay. We have very many classifications of stroke, but the commonest one that we use is on the way the stroke comes about. So we have majorly two. We have what we call the hemorrhagic stroke. Hemorrhagic meaning, it's a scientific term meaning bleeding. Okay, so in that case, blood is, or a blood vessel is bleeding into your brain. So that's what we call the hemorrhagic stroke. Then we have what we call the ischemic stroke. This one is the commonest. Ischemic meaning that there is no longer more blood going to that area, because medically, if any part of the body is no longer receiving blood, we term that as ischemia. So this kind of stroke we call ischemic stroke. It's in a point that that particular part of the brain is no longer receiving blood, and now that can come in because of two. You could have a blockage inside the blood vessel leading to that particular part, or you could have something building up within the blood vessel going to that area. Now, those two take a different course the way they come about. You'll find that this one you have, let me say, you are treating a cancer for a long period of time, you are bedridden, you are no longer moving, so that tends to make your blood to clot easily. Or take, for example, you are having hypertension, like we shall see in the risk factors. You are having hypertension, your heart becomes big, so it sort of develops like pockets where blood is not moving, and at any one time, if your blood is not in motion, it clots. So when it forms a clot, any one time that clot is liable to move away from that position. So if it gets into motion again, it will go through the big blood vessels, but depending on its size, it will reach a point whereby the blood vessel is small, so it can easily block it. The other point, the other one, it's if this is the blood vessel, you are having things like you are smoking, so there is damage inside that blood vessel, so the body will tend to repair that place, but we develop sort of something that we call an atheroma. It is just sort of like a fat deposition within the inner lining of the blood vessel. So with time, it tends to become bigger and bigger and bigger and bigger and bigger. So it tends to compromise that space inside the blood vessel. So with time, it can grow bigger until it has closed off the whole lumen of that blood vessel. So you end also getting what we call the ischemic stroke. So those basically are the two, but medically there are other classifications, but the commonest one that we need to know are those two. You either bleed into the brain, so blood supply to that area is no longer available, or the blood vessel leading to that point is blocked. Yes, please.
Thank you very much, Doctor. Hope our viewers have gotten to note that this stroke is brought up by two main reasons, where blood can overflow or limited blood flow, reduced blood flow into the brain. When you talked of this, actually, like especially on the ischemic one, you said like the blood may clot or thicken up or form a ball. I looked at it like a stone in a pipe, form of blockage. So like water can't flow, so meaning blood here won't flow maybe to these brain cells. So now to ask, you have already started to scare me off. Yeah. So which things could a viewer outside there be doing which could put him at a risk? It could be maybe in lifestyle at risk of getting stroke. Yeah.
Okay, actually I had already started hinting on some of the risk factors. One thing that I had not told you about, of those two, the ischemic stroke is the commonest. And you will see, if you come to the hospital, if you are to see like 100 patients of stroke, you'll find that at least 85 of them are having ischemic stroke. And even our risk factors, you see that most of them are more to that line. So with the risk factors, we have we classify them into two. There are those that you can modify, that is you can do something about them, and there are those that you actually can't do anything. Okay, we shall start with those that whereby you just can't do anything. You have it and you cannot run away from it. Number one is age. So all of us want to be young simply because when we are young there is good life, but as you age there are things that come alongside with age. And if you're not the biggest population that have stroke, you'll find that there are those that are above 40 years old. So that one, there are very many things. As you age, there are those challenges that come in with blood vessels, and they can predispose you to stroke. most of those non-communicable diseases, the diseases that you cannot share or you cannot spread to another person, you'll find that they tend to come in at the later stage of life. So age is actually a risk factor. As you grow, it predisposes you, and you can't avoid that. So you see, that is now the non-modifiable. You cannot change that. 2, we have what we call sex. Now, sex are meaning with your nature, male or female. You'll find that strokes are more common within the male than the women. There are different sort of like things that come into play. You'll find that the men tend to be reserved. They take long to share their problems, whereas the women, they will always come. Even if you don't want to listen, they will be on your neck. So you find that those at a certain degree, they help them relieve off the stress they have. And if you look at some of the complications that, or the diseases, for example hypertension, you'll find that people are stressed, people are having a lot of pressures at work, they're trying to solve this and that on top of the other risk factors. So you find that men tend to get such more diseases that will later predispose them to getting the hypertension. So that is how men, you find us more liable to getting the stroke. Then family history. Now the young viewer out there might think that for me, I'm young, so I'm not at a risk of getting stroke. But there are things that we find that if in your family you have had a history of a stroke, then even the young person is at a risk. You find those people who have in their family, they have diseases that that don't help them. They have problems with some of the metabolism sort of like breaking down some of the things in their body, and they fail to break down some of the components. Now in the young or in a person, there is what we call homocysteine. It's a component that you take from your vitamins and all that. So if the breakdown of that is not proper, it can actually irritate the inner lining of the blood vessel, and it will, in the long run, make you get what we call an atheroma inside. So in the long run, it will make that blockage of of blood inside, blockage of the blood vessel. So even the young can get a stroke. The other thing would be if you're a sickler, you cannot change that. Now you remember with the sickle cell patients, they have these cells, the red blood cells that are moving within the blood and the blood vessel, but they are defected. So when they get crisis, they sort of can easily block any blood vessel that is supplying the brain, so it can give them a stroke. Then we have what we call race. The mere fact that you're an African, it poses you a risk of getting stroke. Now that one has come up because of the different studies. We tend to see that Asians and black Africans are at a higher risk of getting stroke compared to the Caucasians and all the other groups. So those are briefly amongst those that we can't modify. But there are also those that our lifestyle brings us to. Things like smoking. I've actually noticed that in West Nile there is a lot of smoking and eating cat and all those. So some of these components or the constituents in these drugs are not good. Smoking actually majorly is a very big risk factor to stroke. You find that one person is a man, he's having pressure and he's smoking. So he's just compiling 3 risk factors onto one person, so the higher chance of getting stroke there comes in. Now with smoking, there is a component called nicotine. It's within the cigarette. When you smoke, it can go as far as your blood system, and if this is the blood vessel, it irritates the inner lining of the blood vessel inside. So when it irritates there, it's sort of I would say in a lemon, sort of burning inside the blood vessel. So your body, wherever there is a defect, it comes into repair. But sometimes the repairing does not go the way it's needed. So now we are repairing inside the blood vessel where there is a lot of flow. So you can get sort of like a small clot that can be pushed away because of the pressures. And that small clot, however small it is, as it moves through the big blood vessel, there's no problem. But should it get to any point where the blood vessel is small in diameter, it will easily block. At the same time, still in the repair of this place, we can form still what we call the atheroma or the plaque. So you will actually see a blood vessel, but inside there is sort of like a small hill that is developing, and that can develop. So within no time or after a long period of time, you'll see it blocking off. So that's how smoking dangerous it is. Then we have diseases like pressure, hypertension. Now actually most people think that as long as I'm not having the headache, I'm not having any symptom, however much the pressures can go high, I have no problem. But you are playing with fire. This is a disease that kills you slowly but surely. And it is so funny that the pressure and diabetes, they're sort of like sisters. One will always lead you to the other. You will start with one, but you end up getting the other. And both of them are risk factors. Now with the pressure, it makes your heart bigger in size. And remember what we said, blood has to be in moving motion every time. So when you get a bigger heart, it sort of causes like pockets within the heart. You'll find that yes, we have become bigger, but we are thinner in size, and blood is collecting downward. So you'll find that most of the blood that is in motion is down on top. The one down is actually stagnant. And like we said, as long as blood is not in motion, it clots. So you can actually get a clot inside your heart because of hypertension. But you are there, you have no problem, you don't have to have any sign. But that one point in time when you get, let me say, like a happy moment and you are overexcited, and it sort of like spikes a difference in your pressures, those pressures can easily dislodge this clot that is inside the heart. Now when you get out of the heart, there are bigger blood vessels, but they go on becoming smaller and smaller as you get to the different parts of the body. So that big clot can move out from the heart, it has no problem, it goes into your circulation. But as it goes further, the blood vessels are becoming smaller, so it can easily block. So you see how hypertension now gives us a stroke. Once we block, no blood supply to the brain, and that place is off. And the worrying thing is that with the nervous system, the neurons or the nerves take a very short time to die off. Like we shall see in the management, time from the point when you get a stroke is key. Should you take 30 minutes, 2 hours, treatment changes. So they easily die off. They take a very short time. Come to the diabetes, another risk factor. This one, sugar is good, but anything in excess is always harmful. Now sugar irritates, just like you see the nicotine, it irritates the lining of the the blood vessel. So in the long run, it gives you the other atheroma that we are talking about. And still, we have what we call we call it dyslipidemia. Now here we are talking of the fats. You'll find that with these two diseases, that is the pressure and the diabetes, we tend to find that people are having a lot of cholesterol levels within them. And these are coming in because of the different metabolisms that are going on within the body. And those cholesterol levels, when they're high still, they enhance the formation of those atheromas within. They sort of do the inner lining or clog inside the blood vessel. So the lumen that was this size will become smaller and smaller within no time. You have blocked it off. So those are some of the risk factors. We have the modifiable and then the non-modifiable. The modifiable you can change. The modifiable you can change, and those are mostly the behavior changes that we have. The non-modifiable, that one you can't change. Yes, please.
Thank you very much, Doctor. I hope our viewers also you have gotten to note on some of these risk factors or things which could lead to someone developing a stroke. What scared me of age, that one, because the age we can't avoid it. So meaning everyone is at risk of getting stroke as long as you age. Then also, as you have been taking us through some of these risk factors, especially these modifiable ones like maybe hypertension, I was visualizing the whole thing. And I didn't know that the blood vessels supplying the brain, they are too narrow like this. Yeah. So I've gotten also to note that. Also, hope the viewers outside there, you're getting to note things which you could be doing in the community, which could put you at risk of getting or developing this hypertension. Maybe, Doctor, before we go into the signs and symptoms, let's have a short commercial break, and we shall be back brief in the next segment where Doctor will take us through some of the signs and symptoms, how someone can present in case you have this stroke. Then also will take us through the diagnosis when you have this stroke. When you go to the hospital, how do they always confirm, or some of the confirmatory tests they do to know that you have a stroke? And also he'll take us through the preventive measures, because I know also outside there, that's what you want. We want these preventive measures. Let's get back. Thank you.
West Nile TV, lighting up the region. Kylian Mbappe! Jude Bellingham, Vinicius Jr., Lamine Yamal, Antoine Griezmann. La Liga comes to Star Times.
A wild celebration!
The big stars, the tiki-taka football, Real Madrid and Barcelona live in your living room.
Real Madrid, the team of dreams!
Catch all 380 games live and in HD on Sports Premium Channel 259 and Channel 246 starting this August 15th. Subscribe to StarTimes Classic or Smart Bouquet at 36,000 Uganda shillings to enjoy the football experience affordably. StarTimes Football and Limited Passion.
I will be back, dear viewers, from that short commercial break. It's still the Daktari Show, a educative program which airs here on Western TV every Thursday from 11 a.m. to noon, and we always have a repeat for you on Sundays. Today, in the first segment, we were pleased to have Dr. Tony, a medical personnel, a doctor from IMC, who took us through stroke. How can you, things you could be doing at home to put you at a risk of getting this stroke. And me, what I noted, that this stroke is a neurological defect of the body, of the brain, sorry. So in this segment, he's going to take us through some of the signs and symptoms. In case you have a stroke, how can you know that you have a stroke? Doctor, let's pick on. We assume you have taken us through the risk factors. So now we are assuming we have someone, he or she has a stroke. How do they always present? What are some of the signs and symptoms? Yeah.
Yes, the signs and symptoms vary. You might find one patient who is having different signs from the other, but both of them are having a stroke. Now, when we get back to how the stroke comes about, there are points in the brain that control particular parts of the body. It's sort of like a map of the whole body onto the brain. Okay? So we have what we call the homunculus. It is that map of your body inside the brain. So you find that if this is the whole brain, this particular part in front is working on the face. The next part behind it is working on the chin. The other part is working on the hand. The other part is specifically on this little finger. So the whole body is mapped onto your brain. So different blood vessels supply different areas on the body, on the brain. And you find that the clot might be in one and not all of them. For example, look at my hand here. If this is the big blood vessel, it comes but it separates into this smaller blood vessel, and you find this one is supplying your hand, this one is supplying your face, this one is supplying your leg, this one is for sensation, for you to feel, this one is for you to see. So you find that there are different blood vessels but onto one big one. Okay, so when we have a big clot that blocks this bigger one, we shall have all these presentations. Okay, but if we have this smaller one that is blocked, you'll have the presentation for that particular point that it is supplying. So still on the brain, we have sort of like different locations. You find a point in the brain that only works on hearing, another point that only works on you thinking logically, another point that is working on movements. So blood vessels supplying those areas, if they are blocked, you present the same way. But the commonest, how you can easily tell, people, you tend to see on the face, one side will become a little loose. For you to maintain this face and you are able to smile with the mouth equal, it's because of your brain. Okay, it's being supplied by blood, so that point of the brain is working. But when we block off, this half can become loose. So you find that that person and sort of like unbalanced smile, but you would see that the mouth on one end becomes a little loose. So the first thing you will notice, they will start drooling saliva from that side. Because for you to maintain that the saliva does not spill out of your mouth, it's because those muscles, they are working. But remember, they are being controlled by the brain. So if the point inside the brain for the muscles here is switched off, that point will become loose or weak. So when they are eating, food can easily spill or come out from that point. If they are just silent like this, still saliva, they cannot control it that side. That's one side. Then on the arm, you will see this hand that you're able to move it. It's because of the brain. So that side, they are unable to move. Now they can be in a state where they cannot move both the hands and the legs. They can be in a state where the hand can move but with less energy, but the leg is completely, they just can't feel it, and still it can hit you the whole half. What I didn't actually tell you is that the brain, we have sort of like, it is one whole piece. For example, if this is the brain, it is one whole piece, but it can be divided into two, and you find that one half is working on the other end and the other half is working on the other end. And inside our brain, this half controls the opposite side and this other half controls the other side. So the left will control the right will control the left part of the body. So you find the area of maybe seeing, if it's the one that is blocked, they'll lose their sight. If it's the area for speech, they will be unable to speak, but they can hear. Don't forget that they can hear, they cannot speak. They will look at you, listen to you, understand each and everything that you're speaking, but they're unable to talk to you back. So those are some of the presentations. They sort of vary depending on which part of the brain is affected. Is it the one for thinking? They can no longer think logically. Is it the one of sensation? They can no longer feel touch. Is it the one of speech? They can no longer talk. Is it the one of hearing? They can't. Is it the one of moving the muscles? They cannot move the hand. So it sort of varies depending on which blood vessel is affected. Yes, please.
Okay. Thank you very much, Doctor. Hope our viewers, you have gotten to know some of the signs and symptoms, maybe how you can present in case you have a stroke. Doctor, when you're saying of like you can't feel, for us here we is it form of like paralysis? So like the body is paralyzed. Then also another thing which I gotten to note, the human body, as if it is interesting. You said the left part of the brain controls the right part of the body, and the right part of the brain controls the left. It's interesting because me, I thought left with left. Okay, anyways, hope our viewers, you're also getting to learn of these things, although you may not go to a medical school, but some of these basics the viewers are getting to pick. Now maybe Doctor, again to ask, you have taken us through these signs and symptoms. Someone could have picked them or got them on their body while at home. Is it an emergency when someone or a viewer gets these signs and symptoms? Is it an emergency that they have to immediately seek medical care? And also maybe after addressing that question, what are some of the confirmatory tests or the diagnosis you always do in case someone has a stroke and they have come maybe to IMC for a checkup?
Like we said previously, the brain system is formed of neurons or the nerves, and these take a very short time, approximately actually 6 to 8 minutes. You're already having damage or they're starting to die off. So the thing of time to when you come to the hospital is very key. We sort of say medically that time is muscle. The time you spend from the time when you have gotten the first sign to the time when we make the diagnosis and make the intervention is very key. And coming to our low resource, I would say, country, it sort of becomes a challenge in the treatment when you come to the hospital. At IMC, we don't have some of those big machines that can help us to diagnose, but we are privileged that it was, I think last year, but one, Arua Regional Referral Hospital was able to get a CT scan. And basically we need that for starters. But there is also another machine that we call the MRI. This one uses waves to sort of like look into your brain. And the CT scan, it is the easy one to reach access to, and we have one in West Nile. So the moment you present with a sign and symptom of a stroke, maybe you have gotten weakness of your leg, weakness of your hand, or weakness of both your hand and your leg at the same time. Maybe it has just started and your face, you're no longer feeling it. You are seeing your parent, your guardian is drooling saliva from one side. It would be best that you rush to the hospital as quickly as possible, because the earlier we detect where the problem is, like we shall see in the management, we can easily intervene and we restore blood supply to that area. But the longer time we spend, we are unable. We run out of the window period where we are able to work on what could be the problem. But the CT scan will be able to show us which type of stroke it is. And depending on the type of stroke, we are also able now to intervene. Because should you give the treatment for ischemic stroke in a hemorrhagic stroke, you'll just cause problems. So treatment also depends on what we have found. But on diagnosis, the instrument of tool is the CT scan, commonest. And it's able to show us that, okay, this area is becoming ischemic. This area, there is blood that has poured into the brain. So we are able to get to know which kind of stroke depending on the results on the CT. But we can do either CT scan or MRI. In West Nile, we don't have any MRI, but we have a CT scan.
Thank you very much, Doctor, because you are taking us to know on how these people in the community could diagnose, like how you guys always diagnose maybe someone has a stroke, and you have told us of this CT scan and how it does some bit of it. We are grateful. Then you have now, like, because we don't have a patient here, we are just assuming. We assume someone has come to the hospital, you have done the CT scan, maybe you have gotten to know it's either an ischemic stroke or maybe it's a hemorrhagic stroke. Maybe also key to note, the viewers, doctor told us it's an emergency. Yeah, so someone like presented with those signs and symptoms, they have come to the hospital, you have confirmed it's maybe hemorrhagic or ischemic. How do you always manage the hospital management bit of it, and also if it is the home management, which package do you always give to the caretakers of these patients? Yeah.
Yes, thank you very much for that. When you come to the hospital, management will depend on which kind of stroke the patient is having. The commonest, we said it is ischemic, but there are times you have bleeding into your brain, which we call the hemorrhagic. Now with the hemorrhagic, we tend to sort of like control what led to the problem. Was it sort of like an aneurysm? We have aneurysm. Aneurysm, it's sort of like if you see a tire, those who have had bicycles, you ride this bicycle until the tire is getting worn out. It sort of starts developing what we call like a small hump. So that place is sort of like very fragile. It can easily burst. So there are times we develop such onto our blood vessels, and because of the increased pressures, they can burst and they bring about bleeding into the brain. So in cases where we can access easily that blood vessel where it's bleeding and we can achieve hemostasis or stop the bleeding, they can go ahead to open up the brain and stop that bleeding. Though in most cases when the bleeding occurs into the brain, there is sort of like nothing much that we can really do in that case, because trying to go in there to stop bleeding will actually cause more harm than good. And yet in the medical field, it's better not to cause more harm. Okay, so in cases where we see that our treatment will cause no more harm, it's better we leave it at that. Then with the ischemic stroke, you have actually a window of approximately 4 to 6 hours when you have just gotten it. If it is a clot, there are drugs that we can use to break down that clot so that we can achieve blood's flow again. But the issue is we tend to delay. By the time you come after 24 hours, you first went to your clinic, you first thought that someone in the village was bewitching you. So by the time you go through all that ruckus, by the time you come to the hospital, you have gotten out of the window, or whereby those drugs can easily work. But if it is it has just happened, you rush to the hospital, we can sort of like break down that clot, and then blood supply to that area is restored, and so the body part will be able to work again. But if we take a lot of time and it totally blocks off and we are out of the window period, then we cannot help anymore. Then those the atheromas, the ones that develop, if we do a CT scan, they're able to tell us which blood vessel is blocked. So there are times we can go in and we remove that point, but still it depends on which point of the brain, because there are points of the brain where we cannot easily access, and you going there, you are causing more trouble. So we just leave it at that. But if you come in the window period, we are able to break down. Then the issue also, the predisposing factor, we have to work on it. Is it pressure? We have to control the pressure. Is it diabetes? We have to control the diabetes. Is it smoking? We have to improve on our behavior habits and we stop smoking. Because if we don't remove what is really causing it, we are treating the symptom, it will definitely come back. So briefly, in the management, that's how we manage in the hospital. But there is actually a very big role the caretaker or the person out there really does in the hospital. I've seen that when I was still at internship in the regional referral hospital. The senior consultant there, Dr. Male, would tell us some of these people understand. They're unable to speak, but the caretakers are getting tired. Because remember now, this is an adult. You have to change his pampers. You have to feed him simply because he's unable to feed. So it is tiring to the caretaker. But yet, if the caretaker comes in and emotionally supports this patient, it works wonders. On top of the drugs that we are giving, the caretaker also has a very big point to play. So if they start backbiting him in his presence, this one no longer understands. Remember, we said it could be a point whereby he's unable to speak, but he hears and he understands. Yeah. So he will be hearing each and everything that you are saying about him. Yes, but just that he's unable to respond. So that emotional support comes in. 2, these people are mostly bedridden. They are lying on their back, on their side. So it sort of like causes what we call pressure sores. And you find that they can, we shall talk about that in the complications, sort of get wounds on specific points of the body. So the caretaker who is inside the hospital or who is at home having a patient with stroke has to constantly change the position of the patient. So that helps to help him get other wounds and other complications because of the stroke. Then the oral hygiene. Remember, they are unable to brush, they are unable to swallow sometimes. So the person who is the caretaker has to help clean the mouth and remove all these foods that could be remaining within the mouth, clean up his lips, put some Vaseline on top. So there is that non-pharmacological that comes in on the side of the caretaker. But basically, we sort of control the predisposing factor. Is it pressure? Is it diabetes behind? Is it the smoking? Is it the excess alcohol? Is also a risk factor. Then we add on these other things depending on which kind of stroke it is. So briefly, that's sort of how we manage. But the doctors have their part, and the caretaker out there, you also have your part that you do.
Thank you very much, Doctor. Hope our viewers also have gotten to note in this care, it's not only the doctor but also the caretaker, and he told us you play a vital role in this care for these patients who have stroke, especially the emotional bit of it. Then also when you're talking about the medical management, because you said we have these blood clots, I was looking at a clot as form of a ball of blood. So I'm like, if it's in the brain, are they going also to open the brain to pick it out? Form of that. Okay, maybe you'll clear that, and also next you will take us through some of the preventive things a viewer could do in order to safeguard him or herself from getting stroke. Though age is there, but I think we could also prolong the before we get to this stroke.
All right, so with the clots, depending on where it is, we give you sort of like an injection, a drug that will go into your blood system. It will go to your heart will pump, and the blood will go everywhere. So now it is inside your blood, circulating everywhere. So it can go as the atheromas, where it's a hill that formed inside the blood vessel until it clogged it off. That when we are able to get to know which point of the blood vessel is having it, then surgically they can go there and they remove it off. Yes. Now with the prevention bit, prevention comes in with the risk factors. So the risk factor that you're having is the one that we are supposed to work on. I've seen very many people who are having hypertension and they don't care. They will take drugs for this month, next month they'll miss. They'll only come back when the pressures are high. Like we said, hypertension is a silent killer. It kills you slowly but surely. So we need to take our drugs for hypertension seriously. Yes, there are times you come to the regional referral hospital, they have no drugs. But try as much as possible to ensure that you take your drugs when they are availed. Because when you control the pressure, we shall not have the side effects or the complications of the pressure. We talked of the heart becoming bigger. So it's coming in simply because our pressures are high and they're not controlled. So when you control the pressure, the heart becoming big, we sort of limit its rate of progression. So at least you remove that risk factor. Then we have the diabetes. Sugars are very sweet and very nice, but very dangerous still. So we have to control our sugars too. How do you tell someone is having sugars? They're having three things. They urinate a lot, they drink a lot of water, they are always hungry. Those three things are always there. So when you are diagnosed of high glucose levels or the diabetes, please adhere to your treatment. I've seen young girls who don't want to take their insulin simply because they get put some weight and they want to be this small figure. In the long run, you are going to cause yourself problems. Adhere to your insulin, adhere to your drugs that you are swallowing so that you control the sugars. For those that are smoking, it is my humble plea, please stop smoking. Amongst all these risk factors, it is number one. Stop smoking. So it will help us to prevent that. Those that are having sickle cell, we have hydroxyurea. It helps you. It keeps you away from those attacks. So it helps you to keep off or prevent any chance of stroke coming in. Any other risk factor? The ones who are having a lot of cholesterol, there are drugs that we put them on and we help control, but diet and exercise plays wonders there. When you are exercising a lot, it helps your body to burn off the excess fat. It helps to clear all those clots that could be in the atheromas that are developing. It helps you to sort of clear them into. It sort of keeps your blood vessels open enough. So that helps you to prevent a stroke. And what you eat also matters. We call them saturated fats, but just try to have a good balanced diet, I would say. Have a lot of fruits on your menu, have a lot of greens on your menu. It will help you control your diet. So briefly on the prevention, You may not run away from your age. You may not change yourself to become a man, to become a woman if you're a man, but you can control your pressure. You can control your diabetes. You can stop smoking. That one, it's possible. You can decrease. Actually, you can also stop the alcohol that you're taking. Exercise. We have very many hills in West Nile. Traverse all of them.
Thank you very much, Doctor. Indeed, you have made the presentation exciting, and also I hope the viewers have gotten it. Get to not do exercise. We have many hills here in West Nile. He has told us to traverse all of them. Maybe Dr. Time is against us. You can briefly give us some of the complications a viewer who has stroke may develop in case they are reluctant on proper management.
Okay. Now, with the complications, it starts all the way from up to down. Starting with the brain, we said if you backbite them in their presence, if you're looking